Serbisyong para sa bayan.
Handog ng mga eskolar ng bayan. Inihahandog ng National Service Training Program ng Universidad ng Pilipinas Diliman ang
Serbisyong Tatak UP.
Taas kamay, mga bagong bayani, sa harap ng pagsubok, huwag kang susuko. Bigyan ng boses ang sigaw ng masa, ang bagong pag-asa ay mula sa'yo, mula sa'yo, mula sa'yo. Panibagong pag-asa ay mula sa'yo.
Hello mga classmates, nakikinig kayo at nanonood sa Serbisyong Tatak UP, hatid sa inyo ng UP NSTP Diliman Office sa pakikipagtulungan sa DZUP 1602. Kasali ka, ako po si classmate Gian Librojo.
At ako naman po si classmate Ibay. Ang Serbisyong Tatak UP ang programang tumatalakay sa National Service Training Program or NSTP ng UP Diliman. Isa itong gandingan award-winning radio program na kung saan ang mga episodes ay nagagamit bilang resource material sa mga classroom-based discussions ng NSTP sa Diliman.
Alright mga classmates, we're very fortunate to have with us, co-hosting with us here on Serbisyong Tatak UP, NSTP Diliman Office, very own director, si classmate Ibay. Hello ma'am.
Hello Gian. OIC naman. OIC director. It's so nice to finally meet you face to face.
Yes, likewise. A pleasure all mine ma'am.
Yan, sige.
All right, ma'am. So actually, it's a very important moment in the office's history nowadays, no? So I've heard that you're celebrating the 20th anniversary of NSTP here in Diliman. Can you share with us, ma'am, yung inyong mga activities na naka-line up for this celebration?
Yes, meron kaming exhibit ng 20 years of NSTP Diliman. Nandun siya sa Palma Hall ngayon. So 1 week siya. We had our opening last Monday. And then the whole week nandun lang yung exhibit namin, yung lahat ng mga kolehiyo na offer ng NSTP. Nandun meron silang mga naka-display, 'di ba? Mga projects nila sa NSTP. Tapos meron kaming symposium tomorrow sa Sikay Lingkod. That's tomorrow sa AS din siya sa Pilar Hall. And then sa Friday ang aming volunteerism fair sa harap ng Melchor Hall.
All right. Wow. Jam-packed ang schedule ng NSTP Diliman Office. And classmates, if you have the time, please do go to those activities na nakalinya po upang mas malaman ninyo kung ano ba yung mga ginagawa din ng NSTP sa ating komunidad. Alright, ngayon namang araw ay dadako tayo sa panibagong usapin na may kinalaman sa makataong pamamahala sa mga stray animals sa ating komunidad. Ating tatalakayin ang kahalagahan at mga magiging contribution ng mga key actors sa ating community kung paano alagaan at makokontrol ang mga stray animal na kasama natin sa araw-araw na pamumuhay. Napakaraming ang mga stray animals din dito sa ating university, no? Makakasama natin ngayong araw ang isang assistant professor sa College of Veterinary Medicine sa UP Los Baños. He specializes in equine and canine medicine and surgery. He's actively involved in clinical practice as a faculty in charge of the Veterinary Teaching Hospital, Diliman Station. Dito siya nagpapaabot ng serbisyo para sa mga medical and surgical needs ng mga hayop.
He is also known for his participation in various veterinary extension programs such as neuter days and anti-rabies vaccination drives, which contribute to public health initiatives aimed at controlling animal populations and preventing the spread of zoonotic diseases. Ang guest natin sa araw na ito, I'm so excited, ay walang iba kung hindi si Dr. Matthew Benedict Calibo. Welcome sa Serbisyong Tatak UP, classmate Matthew.
Yay, salamat.
Welcome.
Napaka-warm naman at napaka-glamorous naman ng welcome na yun.
It was a mouthful.
Yeah. Thank you for having me. I'm excited to be here and to talk about everything related to animal care. No?
All right. So let's get right to it, no, mga classmates. So classmate Matthew, ano ba yung tungkulin at gampanin nitong Veterinary Teaching Hospital? At ito'y nasa UP Diliman, no?
Correct. Ang Veterinary Teaching Hospital, ang tinatawag nating service arm ng College of Veterinary Medicine, which was originally here. If for the older UP vets, no, they would
My
know this.
parents, Doc Matthew.
Yeah, yung parents ni classmate Ibay ay graduate sa Diliman. But then we moved to Los Baños. And so, despite that, we wanted to keep up a service arm in Diliman. And of course, this hospital caters to every basic need of pet dogs and cats. So if they need checkups, vaccinations, x-rays, or whatever basic checkup or blood test, for example, na kailangan gawin, nandyan kami para tulungan yung mga community animals, pati of course yung mga pets ng everyone in the immediate community of UP Diliman.
Wow, napakadaming ginagawa ng veterinary teaching hospital dito sa UP Diliman, no?
Yes, can you explain to us the teaching component dun sa teaching hospital?
So, since it's a teaching hospital, what you would expect, or the people you would expect to interact with, are not just yung vets on duty or yung faculty on duty like myself, pero pati na rin yung mga students. So, ang mga near or graduating students, mga clinicians as we call them, na malapit nang maging full-fledged veterinarians. Kasi of course, the only way that they will learn, diba, is through doing or the act of doing their clinics. So that's what the hospital is there for. So you could say na marami talaga siyang purpose, no? It helps multiple sets of people, not just as a service to the community, but of course to also teach yung young and upcoming veterinarians natin.
Yeah, so I didn't know if you knew that, classmate Gian, na yung mga classmates natin mula sa UPLB ay pumupunta doon sa VTH yan. So, ayun. So, merong ay, hindi ko alam kung nalalaman din to ng greater student community, di ba, ng UP Diliman, na now we also share the space with students from UPLB.
Actually, medyo matagal na ako dito sa Diliman kasi 2012 ako pumasok, 2016 ako graduate, and since then nag-work na ako dito sa DZUP. And although naalala ko nga na na-feature din ng Veterinary Teaching Hospital at nandito nga siya sa Diliman, mukhang hindi nga siya ganun ka wide or popular knowledge dito sa ating community. So it's really good to have the VTH here with us sa Serbisyong Tatak UP.
I was nervous when you talked about your year that you entered UP. So, usapang student number na ba to?
Ipitan na natin doon, wag natin dagdagan.
Stop na. Ituloy na
Classmate Gian
natin. Okay, so classmate Matthew, bakit po mahalaga ang maayos ng pag-alaga sa mga stray animals sa ating komunidad? Ano po ang connection nito sa public health concerns?
Ang pinaka concern po natin dyan, no, ang health or how it affects the health of the people nearby. So when we talk about strays, we're talking about dogs and cats na nakikita natin na pag-alagala lang sa kalsada, or generally dogs and cats na may have an owner pero hinahayaan lang sila na lumabas ng bahay, tapos may hita lang sa kabilang barangay, parang kabilang bahay na nga minsan, diba, nahihikain or nagdadala ng, ang pinahayaw natin dyan, nagdadala sila ng sakit, nagdadala sila ng minsan, no, nangangagat sila or nangangalmot sila ng mga bata sa daan or mga ibang tao sa daan. So it's always the health and safety concern. Yun yung primary concern natin when it comes to these stray animals.
At classmate Matthew, matanong ko lang, no, kung pwede ba, kunyari meron akong mga pets dito sa university, in the university community, can I bring my pets there to the VTH?
Yes. Our official hours are Tuesday to Saturday for now, ng 7 a.m. to about 2 or 3 p.m. no, nagka-cut off po kami. Pero for this semester so far, ang duty days naming faculty, so when we have students, are Thursdays, Fridays, and Saturdays. So anytime, especially in the mornings, kung mapapadaan po kayo, 7 a.m., 8 a.m. usually puno na eh. Marami nang nakapilang. Kasi hindi lang po yung mga taga-UP, ang, of course, who we cater to. Anyone from outside or nearby or in Metro Manila, no, they come over and then they bring their pets to us, and then they want to have them checked or get second opinions on cases. So lahat po niyan, inaasikaso po namin sila dyan. To the best ng capabilities namin, no, within the day. So yes, for any concerns, kasi Gian, go lang, no, dalhin nyo lang sila sa amin. And then we have a lot of I want to say students or teachers even na tumatawag sa amin, nagtatanong lang kung anong gagawin sa ganitong pet nila or sa hayop na nakita nila sa daan. So ano rin yan, we're very eager to help with regards to these concerns.
Yes. Madami ka bang pets, classmate Gian?
Actually, wala naman. Meron lang kaming house cat.
House cat.
But it's not really my pet.
It's the family cat.
Yeah, it's the family cat,
Yan.
yes. Yeah.
So I think yung gusto ding i-emphasize kasi ni classmate Matthew yung responsible pet ownership. At yan yung isang importante na bagay lalo na within campus. Because a lot of there are pet owners na yung hindi masyadong nababantayan yung mga alaga, 'di ba? Na yun hindi tuloy it's not parang hindi tuloy maganda yung epekto overall ganyan pag napapabayaan, 'di ba? Or napapakawalan, 'di ba? Yung mga pets. Ayan.
Kanina nga nabanggit ni classmate Matthew no na kasi madalas sa ating mga Pilipino no kapag meron tayong pet, madalas kunyari kung pusa ito o aso, lumalabas lang talaga sila, no? Tapos bumabalik lang din sila sa ating bahay. So, talagang isa yan sa mga issue dahil nga, minsan, dala-dala nila yung mga sakit and even the parasites and we don't want that to happen. So, it's really good that we're going to discuss more of that when we return dito sa ating programang Serbisyong Tatak UP. Kaya sa ating pagbabalik, tuloy-tuloy pa rin ang ating diskusyon tungkol sa Alagang Komunidad, Balanseng Pagsusulong ng Kalusugan at Kabutihan ng mga Hayop. Huwag kalimutang i-like ang aming Facebook page, facebook.com/Serbisyong Tatak UP and use the hashtag Serbisyong Tatak UP.
Maaari rin kayong magbigay ng inyong mga opinyon sa comment section ng ating FB Live. Ang DZUP 1602 ay kasapi ng KBP, kapisanan ng mga broadcaster ng Pilipinas. Magbabalik po ang Serbisyong Tatak UP dito sa DZUP 1602. Kasali ka!
Halika na't makinig sa DZUP 1602. Tayo na't makinig sa DZUP 1602. Ikaw ako tayo sa DZUP 1602. Kasali ka!
Hoy, kain na tayo.
Mamaya na, may homework pa ako.
Hoy, late na. Kain na.
Mamaya na kasi.
Kain na tayo, please.
Aray! Ang pagpapalipas ng gutom ay maaaring magdulot ng ulcer o hyperacidity. Ugaliing kumain sa tamang oras. Isang paalala mula sa DZUP 1602, kasali ka.
Kayong makakakita, batiin ninyo siya at huwag kalilimutan ang mga nalugmok sa gabi.
Angel loves, heavy burden do I
Sa
sing.
dagat man irog ng kaligayahan, lahat, pati puso, ay naaagnas ding marahang-marahan.
Wow! Palawakin ang imahinasyon, bukawin ang inspirasyon sa pagbabasa. Isang paalala mula sa DZUP 1602. Kasali ka!
Serbisyong Tatak UP.
And we're back here on Serbisyong Tatak UP dito sa DZUP 1602. Kasali ka, ako pumuli si classmate Gian Librojo.
At ako naman si classmate Ibay. Kasama pa rin natin si classmate Matthew.
Hi,
Hello,
classmate
hello.
Matthew.
Still very happy to be here.
Alright, so kanina no, napag-usapan natin na meron pala tayong Veterinary Teaching Hospital with UPLB students and faculty right here in our university campus dito sa UP Diliman. At nabanggit ni classmate Matthew yung samot-saring mga aktibidad at mga functions na tinutupad at ginagampanan ng nasabing ospital dito sa ating universidad. So dahil nga sinabi natin na pag-uusapan natin ng mas malaliman pa itong Veterinary Teaching Hospital, ay bumalik na tayo sa ating discussion points no upang mas malaman nga natin itong hospital na ito. So base po sa veterinary practices and ethical considerations, classmate Matthew, ano-ano ba yung mga effective strategies sa pag-aalaga at pag-manage ng mga stray dogs and cats which are our usual pets here in the Philippines sa ating communities?
Ang pinakauna po talaga no ay yung sarili niyong aso o sarili niyong pusa, wag niyo hayaang gumala lang, wag niyo hayaang maging stray po sila, no, na nandun sila sa kalsada or nasa labas sila ng bahay, not just for the reasons that they might contract disease or spread disease, no. Of course, number one concern po natin dyan yung rabies. We don't want to spread rabies. Speaking of which, we as a college and as a country, we want to advocate na hopefully by 2030, rabies free na yung Philippines. And of course, one of the best ways to do that ay dapat maliban sa pag-vaccinate sa pets natin, dapat hindi sila nahahagala lang, hindi sila nakahawala lang sa bahay na nagiging stray sila or dumadagdag sila sa population ng mga stray dogs and cats, no. So that's number one, na wag hayaang hindi sila nababantayan, nahahalabas sila ng bahay, not just for the spread of disease, but of course yung safety din po nila. Napakarami pong cases na dumadating sa amin or other private clinics or hospitals na nasagasaan, nabundol, na disgrasya sa labas kasi nga po napapahawalan na iiwan sa labas yung aso o yung pusa. So kawawa naman sila, and then kawawa rin po yung owners nila na napapa-emergency po sila dun. That's the I would, for me, no, yung pinakauna po, pinamahalaga. Number two, in terms of ethical considerations, yung strays po na nasa labas, wag po natin silang paramihin. And in saying that, of course, ako, guilty din po ako dyan, napapahain ako ng mga stray, may inaalagaan, minsan nag-aampon pa ng mga stray, pero wag po natin i-encourage na dumami sila. So these strays, there are, for example, LGUs na pinapound po sila. There are rescue centers or even community groups na nagre-rescue ng mga stray with the hopes na makontrol natin yung population and na maalagaan sila or mahanapan sila ng homes, mahanapan sila ng foster parents or eventual na adopters. Hindi kasi pwedeng ignorante po tayo sa idea na pakainin na natin tapos makita natin na nagme-mate sila. Okay lang yun Hindi na po pwede yun. Dapat, proactive na tayo. And so later, we'll talk more about yung mga activities, community activities, like yung spay and neuter, mga libreng spay and neuter, mga TNVR. These are activities that help us neuter or spay yung mga dogs and cats, lalo yung mga strays, para hindi na sila dumadami sa labas, diba? Hindi na dumadami yung mga stray or tinatawag nating asong kalye or pusakal. Kasi ito yung mga nagdadagdag ng sakit na spread ng hindi lang rabies, mga lepto, mga zoonotic disease sa ibang tao. Hindi lang sa ibang hayop pero pati sa ibang mga tao. Those are the top two concerns, no, or for me, yung mga ethical na dapat exekasuhin.
Yes, and then connected din dito kasi ang responsible pet ownership, kung kunwari pinapabayaan na din yung sarili ng pet sa labas, they contribute to the overpopulation, di ba? Kasi they can also mate with the strays who are outside. So yun, as a pet owner, dapat maging responsable at wag makadagdag sa problema, ganon. So bilang kasunod na katanungan, ano po kaya ang mga epektibo at makataong pamamaraan kung paano natin makokontrol ang populasyon ng mga stray animals?
I think yung number one nga po, no, not just for yung own pets natin, but yung mga nakikita natin sa labas. Or for example, may kapitbahay po tayo na alam natin, no, na yung pusa niya last year, isa lang, dalawa lang, ngayon medyo 10 na. Medyo kailangan pagsabihan, medyo dapat i-share sa kanya na merong mga libreng
guilty ako,
may mga libreng spay and neuter. For example, kami sa VTH, we just had our free neuter days, spay and neuter event. This was last month, nung September. We have one in here in Diliman, and then we also have one in Los Baños in the 2 VTHs. And many LGUs and even local private clinics or hospitals, marami nang nag-free spay and neuter. Check nyo lang sa Facebook, check nyo lang sa online. It's a good way to neuter pets that are not meant for breeding or hindi nyo balak na i-breed, or lalo na yung mga pets na nahahayaan sa labas at nakikita natin na nag-overpopulate. Ayan, i-neuter natin sila. And believe it or not, this can even in some ways help their health. It can make sure na hindi sila magkasakit na contracted through contact or through going around with other males and females, no, na mga dogs and cats. And then aside from itong mga libreng kapon, kung tawagin, no, mahalaga rin na maingatan sila na hindi sila nagko-contract ng disease or ng parasites, and the best way to do that is to get them checked, to get them their regular annual vaccinations, mga anti-rabies, mga tawaging 5-in-1, sa cats mga 4-in-1, and there are so many medications nowadays to prevent ticks, fleas, mites, mga external parasites. Kasi ito, no, half joke pero half totoo rin. Minsan yung mga nagdadala ng stray sa amin na nire-rescue, sa simula yung pusa o yung aso lang yung may garapata o may kuto, pero after 1 month pag di malagaan, pati na yung nagdadala sa kanila, meron na silang mga galis or mga skin patches. So alam mo yun, a lot of parasites and diseases can spread from pets or from animals to us, and even vice versa. So
But I'm really curious, classmate Matthew, no? Like, kapag kunyari may TNVR program, like how long would it take but for us to see like an impact, diba, that it's working, and then kasi minsan magkakaroon mawawala yung programa, yung parang walang, minsan napuputol. So parang how often ba siya dapat ginagawa for a certain, by land area ba yan? Or by certain population, gano'n?
By land area and land mass, opo.
Diba? Gano'n ka? Kasi nakwento nga, oo, iba yung, halimbawa, iba yung scenario sa UP Los Baños, iba din yung scenario dito sa UP Diliman. So, parang in your experience, gano'n, how long does it usually take to actually
to get the impact, to see the impact? Other countries, according to the studies, no, in other countries, they're already doing these TNVRs or spay and neuters ng quarterly, sometimes more often. So tayo medyo kulang, no? We do ours usually once a year lang. Buti nga tayo last year twice a year po kami ni Ma'am Ibay with all of their help. Pero with regards to impact, you'll start to see the impact mga 1 to 5 years pa down the line, which is why we need to be proactive. Kailangan lahat tayo, no, sa komunidad, sikapin na po natin na magsabi sa mga kaibigan natin na pag hindi niyo po balak i-breed yung mga alagang aso o pusa ninyo, lalo na yung mga nasa labas, ipakapon na po natin. Kasi wala namang mawawala, lalo na pagka doon kayo sumabay sa libreng kapon sa TNVR, sa spay and neuter. It keeps them healthy, it prevents disease, it prevents overpopulation, and then as a community or even as a country, we'll see the effects 1 to 5 years more so down the line, na less na yung strays, less na yung kailangang i-rescue sa kalsada, less na yung mga kawawang aso o pusa sa daan, kasi naalagaan na natin sila na we prevent overpopulation, and we make sure na the pets that we have are cared for, no, as a whole.
And it has to be regular, kasi ayan.
A follow-up on that, classmate Matthew. Siguro I'm going to wear my devil's advocate hat, no, in terms of like doing the trap neuter and the spaying also. For example, for cats, they were domesticated in the first place so that they could combat din yung the pest that is the rats.
The rats,
so
the mice.
Won't it also affect the natural way of combating the population of rats? Yeah.
Actually, no. With regards to yung pagtanggal lang ng no mga sex organs po nila, it should not. With regards to yung cats na marunong manghuli or mag-terminate po ng mga pests natin. But of course, iba na dyan yung mga may mga pusa kasi na marunong talaga, may mga pusa na na hindi marunong. Pero of course, yung mga marurunong talaga na pusa, hindi naman po nun ma-deter yung kanilang instinct to go after these mice or these rats or the vermin. As long as they're kept healthy before, during, and after the surgeries or yung pag-spay, they will be fine. Lalo na yung mga male, yung mga nanoneuter, hindi po niyan matatanggal yung yung drive nila na pumatay ng mga pest po natin sa bahay or sa community.
Alright, and another question, kasi kanina nabanggit yung sakit na rabies, which is actually a very old sickness, no? I remember in one of my classes in UP, no, na ang rabies ay nakikita rin pala sa mga Egyptian hieroglyphics, no?
Yeah.
So ibig sabihin matagal na siyang sakit, no? And pero meron tayong paraan to actually combat that, no? And we know that rabies is a deadly disease, no? Kapag umabot ka na sa punto na nagma-manifest na yung symptoms, you are most likely to die, right?
Yes.
So meron ba tayong ABCs or animal bite centers in the TVH?
In the VTH, you mean?
VTH, yes. VTH.
The annual bite centers specifically cater to people, no? So people na nahagat or are in danger or at risk of contracting the disease kasi they came into contact with a stray dog or cat na hindi sila sure kung vaccinated. So these ABCs are found usually malapit sa mga LGU na barangay hall, barangay center, or even most hospitals are already considered ABCs. A lot of them you'll find also online. Luckily ngayon marami na compared to before na hahanapin mo pa talaga sila. But the VTH or most vet hospitals or clinics, those naman will give anti-rabies vaccines to pets, dogs and cats.
Animals, yes.
But that's a very valid question kasi marami rin pupunta sa VTH na nagtatanong na papa-anti-rabies nila yung aso nila, tapos pwede bang sabay na sila? So kasi nagko-cross po kasi yun between vets and the MDs. So dapat sa naman sa ABCs, Animal Bite Centers, or sa MDs yung mga bibigay po ng for the people.
For the humans.
That's interesting.
But that's a very good. That's also a very good point. Na rabies, yes, is a very old disease. We always say it's 100% fatal kasi nga once you get it, it basically means na terminal na po siya.
Yes.
But the good news is it's 100% preventable.
Yes.
And the simplest way to do that is to just get vaccinated.
Yeah.
So if you vaccinate your dogs and your cats and you make sure the community animals are vaccinated, then you basically make sure na walang nagdadala ng rabies sa paligid ninyo or sa community ninyo. More so pa, if you yourself, kung marami po kayong alagang aso o pusa, there's nothing wrong with getting vaccinated. You will be protected, and you also make sure na if you or your family members are bitten by strays, at least kampante kayo na meron na kayong protection, and you can even go for post-exposure vaccines after to make sure talagang foolproof.
Just to be very safe. So we wouldn't want people dying because of rabies because it's actually very preventable.
Very preventable, yes.
All right. So another question, classmate Matthew, although you were able to discuss this in passing kanina, what are the other health risks that are involved in the increasing number of stray animals, and how can we balance these concerns with the need to care for and protect these animals?
Let's go back to something I mentioned earlier, lalo na kakatapos nung rainy season natin. Leptospirosis, I think a lot of us know about this disease. Natatransmit siya usually by rats or mice na infected with it, and then their urine gets caught in the blood or in the rainwaters, and then it's transmitted through the waters that pass around during the rainy season. So this is one of the biggest diseases that affects yung pets, dogs, cats, primarily dogs, na gala or nakakainom ng rainwater sa labas, they get the disease. And so those dogs, when they urinate or if they bleed on other animals, or even for example on other humans, maihian nila yung yung owner nila, for example, and then the owner doesn't wash their hands or has an open wound on their leg, you can also contract leptospirosis. So that's just one example of a very deadly disease. This disease.
I'm shocked na may ganon na pala na pwedeng mangyari yun.
Napakadelikado po ng disease na to. And yung mga natin, yung mga rescue personnel natin, sanay sila dyan na they take prophylactic medicines to combat leptospirosis kasi nga madalas sa baha or pag tag-ulan meron yan. So this is one of the diseases na you really have to watch out for, na zoonotic as we call it, can transfer from animals to humans. Kasi if we don't take care of our animals, mga pet dogs, pet cats, and lalo na yung mga strays, mga community animals natin, pwede silang mag-transmit ng mga ganyang disease. And so many other bacteria that can transfer orally. So for example, yun nga, kung yung hygiene medyo lacking, yung mga bacterial disease ng dogs and cats pwedeng mapunta sa atin, can cause diarrhea, can cause vomiting. I've seen this happen na rin with other pet owners, parehas silang may sakit, parehas silang may sipon, for example. So these are all basically related to the idea na yung sakit na lilipat po yan mula aso, pusa, minsan pupunta sa tao. So, wag na po nating i-take yung risk. I-ano na natin, i-curb na natin yung disease doon pa lang sa pets natin. If they're healthy, then more likely we're also healthy.
How serious is leptospirosis? I mean, what happens ba pag if you
Pag
contract?
nagka-leptospirosis, it's a deadly parasite that likes to house in the kidneys. So it will destroy your kidneys, sometimes pati yung liver. Ito yung, if you see in mga medical shows, no, yung mga naninilaw na tao or naninilaw na dogs and cats, ayan, sometimes leptospirosis po yan. It's very deadly. If you're not able to medicate it early, it can be fatal. So ano siya, we medicate very aggressively. So to prevent that, luckily may vaccine din, kasama yan sa 5-in-1 vaccine for the dogs. And of course, pagka nagkasakit na, may mga antibiotics po na binibigay or may mga ibang gamot na tinuturok, maraming nako-confine minsan para sa lepto.
Ang laki din ng cost implication din, no? I mean, like for pet owners, because you have the responsibility then to do all these things. What would ano kaya yung mga best, like kasi alam ko may mga free din naman na vaccines paminsan-minsan, meron mga free na campaign, but like ano ba usually yung nagiging cost niyan kung hindi ka maano sa free?
If it's not, well, the simplest I think is also the preventive medicine is always best. Pati para sa pet owners po, no, always remember, mas gagastos po kayo pagka nagkasakit kaysa sa yung gumastos kayo sa vaccines or sa anti-parasite medication or parasite preventives. Mas mura yon kaysa sa gagastos kayo pagka nagkasakit na, ma-confine na, medyo malala na. So that's number one. Number two is more of let's call it management. Pagka, for example, maulan sa labas or bumabaha sa labas, pag nakalabas yung aso nyo or yung pusa po ninyo, of course, pag bumalik siya sa loob, punasin yung paa, siguraduhin hindi madumi yung coat nila or yung fur nila kasi dala niyan yung yun nga, possible na bacteria or lepto or other parasites from the rain. The same goes if you bring your pet dog or cat to a park or to anywhere with grass or soil. You can expect na may parasites na dala yan. So before you enter the car or before you enter your home, clean up their paws, clean up their tails, make sure na walang sumasabit sa limbs or sa extremities nila. It's more just a management concern. And then going back to our concern with strays po, no? Kung may makita po kayo na aso o pusa na sabihin na lang natin na hindi po kayo sigurado sa condition niya, sa health niya or kung vaccinated siya, wag niyo na pong i-risk na makipaglaro yung aso niyo or yung pusa niyo doon sa stray na yon, especially if may signs po ng may sakit yung animal na yon or yung ano na yon, or even other pets, if they look like they're not healthy, then just be polite and don't take the risk. Wag niyo na pong ilapit yung aso, yung pusa, yung alaga niyo doon kasi baka ma-contract mo na yung disease. And then goes vice versa.
Actually kami, ako, my dog, hindi ko pinapalabas yan. I'm very conscious of those things. Even my cats, bawal lumabas ng bahay. Ayan. Pero bago po tayo dumako sa huling segment, given the factors and elements shared in a healthy and humane way of managing stray animals and also caring for both our owned companion animals and the stray community animals, ano po kaya ang magiging role po ng mga veterinarians, especially UP veterinarians?
I think veterinarians are those who are or should be most in charge of educating everyone. Educating, kasi of course, primarily, we're taught to medicate yung animals, yung different species, in my case, yung pet dogs and cats. But we're also taught, lalo na kaming mga UP vets, we're also taught our other role, which is to educate yung other people about the diseases, animal health, public safety, ayan, zoonotic disease. And in my case, lalo kami sa VTH, aside from medicating pets or rescue dogs and cats, it's about educating the local or immediate community about the health concerns and how to keep your pets healthy, how to keep everyone safe, prevent disease, prevent accidents even, no? Sa mga pet dogs and cats, lalo na yung those that need our care the most, yung mga napapabayaan po sa community.
I think one good way to manage really the situation really is to keep your pets at home, no? Ito nga yung sinasabi ni classmates Matthew and classmate Ibay kanina na I mean they won't get diseases from other animals or even in the environment, and they won't be able to pass it around also, and they won't get into accidents also if you just make them stay inside your homes, no. So it's one good cost efficient way to prevent such diseases and accidents from happening in the first place, no.
Yes, and then for pet owners who love to have their cats or dogs with them, 'di ba? All the time talagang merong emotional comfort din kasi, 'di ba? Pagkasama there, we have a lot of classmates, 'di ba, na laging kasama din yung mga pets, 'di ba? Yung mga tips ni classmate Matthew na pag-uwi nyo, yun kailangan linisin yung paws, i-wipe yung coat, ganun, just to make sure na walang nauwi na
Nasakit.
O lalo na pag sa park, 'di ba? Even sa malls or even mixing with the other dogs na pumapasyal din. Meron din kasing mahilig na kasama yung mga pets nila pag pumasyal. So yun, I guess ako as a matter of preference lang talaga, yun.
Just keep them inside, yeah.
Oo, sa bahay lang sila. Ayun. So,
actually, classmate Ibay, may gusto pa akong tanungin pa, naihabol, no? Dahil nga, nabanggit ni classmate Matthew kanina na the VTH is a teaching hospital, and it not only teaches the students of UPLB who are taking veterinary courses, but also the community, to make sure that the animals are also protected and also the humans. So, isa kasi sa mga issue natin dito sa ating lipunan here in the Philippines is really, in the Philippines case, we have a low health seeking what you call this habit.
That's correct.
Right?
That's very correct.
Even for ourselves, we don't usually go to the hospital if we feel sick, right? Because we are averse to that situation.
Takot sa doktor, no?
Yes, correct, exactly. So how can we even, if we can't do it also for ourselves, how can we make sure or educate people to do the very same thing for their animals?
Kami sa VTH, we always encourage na aside from, kasi pag puppies or kittens, madali, automatically may vaccines yan, pinapa-check up po kaagad para lang ma-update or makita kung ano yung gagawin, lalo pag mga bagong pet owners. But after that, what we always recommend is once a year, if your pet is generally okay, even if wala namang naging concern, wala naman siyang sakit, hopefully wala naman siyang complex na sakit or grave na concern, once a year, there's nothing wrong with going to your local veterinarian or your trusted veterinarian. Tapos magtanong lang po kayo, Doc, pa-check naman po yung aso ho, pa-check naman po yung pusa ho, patingin lang kung merong dapat i-check sa kanya, merong dapat i-screen or may concern ba sa health niya na hindi ko nakikita. And actually, we also prefer that. Mas gusto namin na nakikita sila ng healthy, tapos ma-check kung all the blood is okay, all the blood work are normal, walang mga pressing concerns, how are they doing with regards to their age, obese po ba sila, or masyadong payat. Mas gusto namin yon kaysa sa yung darating sila, 5 araw na silang di kumakain, 2 araw na silang nagsusuka, tapos mahirap na pong habulin yon. Mas gusto namin na check namin sila and we see their baseline value or how they are ng healthy po, no? And on the flip side of that, mas magiging kampante rin po kayo knowing na healthy yung pet ninyo or na napacheck ninyo at may maagapan na tayong sakit, no, sa ganong mga concern. So it's a win-win. It's not big hassle for the vet kasi hindi naman malala yung sakit ng aso o ng pusa. Hindi rin kayo masyadong papagastos or hindi rin kayo masyadong ma-stress kasi napag-usapan nyo na ng vet yung mga concerns before they get big or bago sila lumala. So really, there's nothing wrong with going to the vet or even just calling up and checking kung valid yung concern. Dapat po bang dalhin sa ospital? Dapat bang dalhin sa emergency na clinic? Or pwedeng na lang i-schedule yung check-up niya? Mas po namin yun. Mas prefer po namin yun.
Minsan kasi nagiging challenge din yung, I guess for some people, the time to do it, di ba? Pero kasi at least once a year, parang that's supposed to be simple enough, di ba? Once lang sa isang taon. May iba din namang options sa kung kunwari nahihirapan to transport. There are also veterinarians who go on house calls. So there's really many ways.
Many ways
na pwedeng
nowadays,
ma-check up,
yes, thankfully.
diba? So yon. So hindi siya ganoon kahirap sa na sana na gagawa din ito if you're a pet owner.
I think maybe the best message I can put forward is wag po kayong matakot na magtanong, na tumawag sa VTH or sa local na vet clinic, kasi mas okay po yun kaysa sa tatawag kayo na may emergency na na in dire need yung pet po ninyo. Mas okay na tumatawag kayo na magtatanong lang kung dapat ipa-check up o hindi. Mas na po yun.
2 questions, classmate Matthew. How much is the consultation fee at VTH?
The current consultation fee in the veterinary teaching hospital is 250 pesos lang. So, di ba
Affordable.
Napaka-affordable.
Yes.
Of course, everything else will change pagka may mga pina-blood test or may mga pina-x-ray. But just for consultation, because nga it's a teaching hospital and we want the students and even yung mga fresh grads sometimes to learn, we keep it very affordable sa VTH. I think kaya rin maraming pumupunta.
Ang haba ng pila. Yeah, you have to get there really early to be on the wait list. And then yun, mag-aantay ka talaga.
Yeah.
But that's very common with very magagaling na mga vet.
Naks.
Yan.
Yes.
High five.
Pinipilahan.
Yeah, and also it's affordable also, no? For all the other services that you offer, discounted, subsidized by the government?
Sadly, we are not a subsidized body. No? We're not subsidized by the government. But I think our rates are very friendly compared to other private hospitals, simply because nga it's a teaching hospital.
Okay. And also, where are the VTHs located? Here in Diliman and in Los Baños?
There's one in here behind the Fine Arts Building here in UP Diliman. The other one is in UP Los Baños, inside the compound of IRI, the International Rice Research Institute. Yun, nasa medyo dulo siya sa Maahas Station, we call it. Yun yung barangay Maahas.
Alright. And last question regarding the VTH. Sa VTH in Diliman, how many are the staff there, the faculty, and the students also?
So the faculty rotates. Sometimes there's 1 or 2 faculty on duty per day, depending on the semester and depending on the number of students. And then there are currently 5 staff, so that's distributed between the nurse, the rad tech, yung sa x-rays, yung sa lab, etc. So ano yan, para siyang Swiss knife ng staff sa VTH.
Alright. A well-oiled machine. The VTH here in Diliman and also in Los Baños. And we have our incredible faculty, staff, and students to thank for also. So, magpapatuloy ang ating diskusyon tungkol dito sa VTH sa ating programang Serbisyong Tatak UP. Huwag kalimutang i-like ang aming Facebook page, facebook.com/Serbisyong Tatak UP, and use the hashtag Serbisyong Tatak UP.
Ang DZUP 1602 ay kasapi ng KBP, kapisanan ng mga broadcaster ng Pilipinas. Magbabalik po ang Serbisyong Tatak UP dito sa DZUP 1602. Kasali ka!
Halika na't makinig sa DZUP 1602. Tayo na't makinig sa DZUP 1602. Ikaw ako tayo sa DZUP 1602. Kasali ka!
Uy, mag-alas 5 na. Tara, labas tayo.
Sige, tapos na ako eh. Saan mo gusto kumain?
Kahit saan, basta may aircon. Ang init kanina eh.
Hala, ang lakas ng ulan. May payong ka ba? Wala akong dala kasi maaraw kanina eh.
Ako din, wala akong payong. Hindi ako handa, ulan pala.
Laging maging handa. Huwag kakalimutang magdala ng payong, tubig at iba pang emergency equipment tuwing lalabas ng bahay. Alamin ang mga weather updates at maging handa para sa mga ito. Isang paalala mula sa DZUP 1602, kasali ka.
Abay Juan, itigil mo na nga yung paninigarilyo mo.
Minsan-minsan lang naman to.
Isipin mo naman kami ng anak mo.
Papa, game ko na sa Sabado. Makapunta ka naman, di ba?
Oo naman anak.
Ayon sa Civil Service Commission, 240 Pilipino ang namamatay araw-araw dulot ng paninigarilyo. Walang kasiguraduhan kung kailan kanito maapektuhan. Isang paalala mula sa DZUP 1602, kasali ka.
Serbisyong Tatak UP.
And we're on our last stretch here on Serbisyong Tatak UP sa DZUP 1602. Kasalik ako po si classmate Gian Librojo.
At ako naman si classmate Ibay. At kasama pa rin natin si classmate Matthew. Gian, bigyan mo kami ng recap. Classmate Gian pala ang tawagan dito.
Yes. So sa ating mga kasali, mga classmates, no, kanina napag-usapan natin with the help of classmate Matthew kung ano ba yung mga ethical considerations din na iniisip, no, pagdating sa pagtugon sa mga issue na may kinalaman sa ating mga pets o mga alagang hayop. And I think isa sa mga napag-usapan din, if we remember, no, ay yung leptospirosis, rabies, and actually, isa sa mga in-emphasize si classmate Matthew is actually that prevention is always better than cure. And it's actually much more cost-efficient also to invest in prevention rather than spend during
Emergency.
an emergency, no? And actually, classmate Matthew, matanong ko lang, may emergency services ba ang VTH?
We accept emergency cases, but only within yung yung hours namin ng 7 to 2 or about 3 o'clock. Although we're open until 4, usually with the cases that we're handling, yung mga nagpa-pile over from the morning, we call it triage, no, sa medical community. So may triage system kami na pag may dumating na emergency, of course, if true emergency siya sa, for example, na dumudugo, may active bleeding, or has difficulty breathing, yun, automatically sila yung pinaprioritize. And then yung mga nakapila na hindi naman in dire need of help, they will wait, no, na maasikaso muna yung emergency case. That's actually one of the best ways that the students learn. I forgot to mention earlier na aside from the 1 to 2 faculty on duty na vets, merong students na sometimes, it depends on the population, but it ranges between 7 to 14 students per day na on duty. So sabi nga ng ibang mga clients, pagka may students on duty, na hihita nila yung yung mga nagto-tornado na students dun sa VTH. Pero pag kaming faculty lang o yung mga resident vets lang, very calm yung VTH. But yun, going back, yes, we do accept emergency cases, sadly only within the hours that we are allowed to work. Kasi hindi po kami 24-hour facility, or at least not yet, no. Hopefully in the future when we get better funding, fingers crossed, no. That will be nice.
That's a really good question, Jane. I think it's something that a lot of pet owners have issues with. Yung pag biglang emergency, I get calls din kasi dahil veterinarian ang aking mga parents. So biglang ako yung tinatanong, I'm like, I'm not a vet, ganyan. Pero but a lot of people kasi nagiging problem nila yung pag emergency case and all the clinics are closed. Meron bang mga 24/7, 24-hour clinics?
There are a few, yes. May ilan naman po na 24-hour clinics. Most of them are, I believe, in Metro Manila lang may ilan sa Katipunan, merong ilan sa mostly in Quezon City, I think, when I think of the ones that are 24 hours. So I think it would be best if you check online or you check sa local community groups kung alin yung mga 24 hours, because it's, I would say, difficult, no, for a clinic or a private clinic to keep a 24-hour clinic going, a 24-hour veterinary operation going. So ilan lang po sila. I can't say specifically which ones ng without first checking.
Yes, yun din kasi yun din yung lagi kong na-encounter na question. Saan pwedeng dalhin, ganyan. Pag kunwari midnight, yung very very madaling araw, ganyan. And I guess, well, hindi kasi tulad ng ospital na 24/7 ang operations. Karamihan talaga ng mga vet clinic or vet hospital, talagang within certain hours lang talaga sila open. So, yun din ang isang nagiging challenge per pet owners.
You would have to think about the costs also in running the 24/7 vet hospitals also. So I think that's why there are not so many even here in Metro Manila, no? And also, a classmate, Matthew, nabanggit mo kanina that pag may mga estudyante sa VTH, usually may nakikitang mga nagtotornado ng mga students, and maganda yung nabanggit mo na isa sa mga tinuturo ng ng mga medical schools din ay yung to do triage, no? Can you expound kung ano nga ba itong triage, at least in your field?
The simple way of putting it is triage assesses yung critical care needed, no? So for example, let's give a concrete example para madali po siyang maintindihan, no? If say 3 dogs come in, 1 dog needs vaccinations, that's dog 1, and then dog 2 has say a fever and is not able to urinate, and then dog 3 is a dog that has a slight limp kasi na-sprain niya yung ankle niya. Opo. So then we'll ask the students, alin po dun sa tatlo yung dapat na unang ma-check? Alin dun sa unang tatlo yung dapat na i-prioritize, not just because nauna sila, or not just because ito yung parang pinaka-cute. For example,
pwede ba kami mag-guess ni classmate Gian ng answer?
Sige po.
Si A, B, or C?
Si dog 1, dog 2 or dog 3?
Dog 1 is
Vaccines, needs vaccines. Dog 2 is unable to urinate.
Tapos may lagnat.
Lagnat po siya. And then dog 3 has a slight limp. Mukhang na-sprain po niya yung isa niyang paa.
Sa akin si dog 2.
Yes, I concur.
Correct. 100 na.
Yes.
100% na sa quiz.
Yes.
Basta uno na. No, but yes, that's the simplest way of putting it. Of course, it's nice to see in practice because kaya po yung unang na-encounter ng most clients sa VTH ay yung students. Kasi sila yung tinuturoang mag-triage.
Yes.
So pagdating niyo po doon, ang una yung makakausap usually kung hindi staff ay estudyante, magtatanong ano po yung concern, tapos ipapalista po yung concern.
Yes.
And then i-assign na po yun sa vet on duty or sa faculty or sa senior clinician on duty para ma-assess at gagawin niya yung next step. So there are cases like you said earlier na emergency na automatic and nadalhin yan sa emergency room, may oxygen or may lalagay na swero kasi in critical need po ng ng parang ma-ICU yung pasyente po na yun. And then others dadalhin sa pila ng vaccinations, deworming, or ng general na check-up lang.
I think very difficult to be a veterinarian because your patients do not speak.
Yes,
so
correct.
ang hirap nung
parang baby.
Oo. Kasi hindi mo anong nararamdaman mo ganun.
No, you can't.
Yeah, so
kumbaga the owner has to speak for the pet.
Yes. And that's that's one of the fun things for me, at least yung fun side ng profession po namin is you sort of have to gauge because the owner naman will most of the time have the purest intentions.
Yeah.
But it matters that you have to know how to read or have to assess the pet.
Yeah.
And that goes for all the vets in all the species now, from dogs, cats to horses, cows, or even pigs. Kasi ikaw lang po yung kayong vets lang yung magde-determine or mag-assess kung kumusta yung animal na yun. And then your assessment will determine what the next step is and the next step is and what medication needs to be given. So for me, that's the fun part, one of the fun parts of the profession.
So kung very interested kayo sa pinag-uusapan namin mga kasali, you might want to consider taking up veterinary at the UP Los Baños, no? If you would want, no?
A 7-year course?
6 year lang.
6 year. 7. So
kala ko parang intramed. Mga 7 years.
May mga ganun po. But yeah, 6 years. VetMed is a 6-year course ng na yun, from start to finish. When you graduate, you have the title of Doctor of Veterinary Medicine. So, actually, recently, we have a lot more, our population has grown, no? Parang 2-3-fold in the previous decade, lalo post-pandemic with the rise in pet care or animal concerns.
Yeah.
So, it's nice to see. Ang hindi lang nice to see ay kulang yung facilities or yung space ng classroom namin para sa dami ng mga vet students namin. But yun nga, it's nice to see.
What are the different practices? I'm sorry, I interrupted.
No, it's okay.
Like, because you said there's small animal, there's what are the different fields but within the veterinary practice?
The big basic fields are companion animal practice, so dogs, cats, kasama na po doon yung equine, yung mga horses.
Yeah.
And then there's food animal practice, so anything involving chickens, pigs, cows, sometimes even carabaos. And then there's exotics, very popular, rising popularity nowadays. Yung mga nag-aalaga ng exotic birds,
Okay.
sometimes reptiles.
So snakes.
Yeah, mga snakes. Opo, I'm sure a lot of people are fond. And then, ano po yan, meron ding lab animal medicine, yung mga rats that are used in the laboratories, sometimes rabbits. Marami ng field, but those are the broad classifications.
It's very important nga, especially when we talk about food. So, the people who know about veterinary medicine should be the ones handling those animals. The animals that we eat.
Yeah. Pero naisip ko tuloy, if you have a pet iguana, where do you bring you can't bring a pet iguana. Can we bring a pet iguana to the veterinary teaching hospital?
Is it legal in the first place?
Wala pa iguana. Sige, legal naman, legal.
I'm not sure.
Ahas ba?
It depends. There is the Wildlife Reserve Center naman. Diyan po sa sa QC Circle. I forgot which avenue it's on. I think Visayas. But yeah, meron po dyan yung BMB kung tawagin. There are also certain private vet clinics that cater to exotics. Marami dyan mga nagdadala ng turtles or tortoises, rabbits, yan, mga cockatoos nila. Yan, mga legal naman yan.
Okay.
Marami rin po dyan.
So, birds in general, hindi dinadala sa VTH?
No. Sometimes when we have a faculty, or we have some faculty that also specialize in exotics, when they're on duty, pwede. Before that would happen. But on a regular day ng coming dogs and cats, not so much.
I see. Okay. Right. So since we're this is Serbisyong Tatak UP, so we have to talk about NSTP, no? So regarding the NSTP students, what can our NSTP students and our NSRC reservists actually do with the knowledge also regarding veterinary medicine, classmate Matthew?
I think, or with regards not just to vet med, but also to everything we talked about.
Yes.
Nito lang today. I think it would be great if they look into the local, if not the LGUs, but the local community organizations that help in mga free rabies drives, mga free spay neuters or TNVRs. Lalo na in Quezon City, marami ng barangay or LGUs na nag-free rabies free anti-rabies or free rabies vaccines. I think these are excellent places to volunteer in. Or at least yun yung ginagawa namin before, yung several student groups sa UPLB pag nag-NSTP, ayan, may ibang mga tumutulong sa ibang events. Lalo na nowadays, marami ng there are new events like for example, pet adoptions or yung mga pag-adopt ng mga rescue animals. These are great ways to advocate for pet health and the human-animal bond, the community between us and our pets and the local dogs and cats, keeping all of these components healthy. Aside from that, if they want to volunteer sa amin, why not? Why not? No.
Sige.
They just need to contact us. Of course, may mga events po, no? Not on a regular day kasi medical yung field dapat. But there are events like yung when we did our TNVR, Ma'am Ibay, or when we do our spay and neuter.
Yeah.
Meron dyan sila mismo yung nagdala ng batches of dogs and cats na isa-spay or na-neuter para nakakatulong din sila sa local community nila.
How must they prepare themselves if they are to undertake projects such as that? Kasi it's unlike kayo, the veterinarians, meron kayong, you're well prepared, you also have the prophylactic, di ba, for anti-rabies also, but of course if you're like a regular citizen, halimbawa, I'm not, but I want to be involved in mga events such as those, diba? Kaya lang I cannot touch the animals, parang ganun. So, paano mag-prepare dapat? Ano lang yung extent na pwedeng gawin, diba, ng mga estudyante or mga, lalo na estudyante ng mga NSTP if they want to get involved in mga projects tulad nito?
Yeah, the first is really to contact the organizing body. Kasi marami naman pong jobs na pwede nalang gawin na hindi sila at risk na makalmot or mahagat, lalo yung sa logistics, sa registration, everything that the vet or the adopters or yung whoever is in charge, no, where they need help in, if they want to go a step further and help talaga with the handling of the animals, we always say number one thing is you have to get your anti-rabies vaccine. You have to get your prophylaxis, your shots. Sometimes kasama dyan yung tetanus vaccine to be safe. And then other than that, I would say contact your local veterinarian, your friend veterinarian, or your local veterinary clinic. Before, when I was working in a private vet clinic, marami dyan mga students na are looking for either a project or something to do ng sem break or summer break. They would volunteer with the clinic. Ano lang sila, tutulong sila sa logistic work or sa registration work nung pets pagdating sa clinic, and then they'll just hover over us or watch what we do. And believe it or not, some of these volunteers, iba dyan mga undergrad or kakatapos lang ng first degree nila. Believe it or not, a lot of them, at least the ones I know, they went on to take their second degree. Nag-vet med sila.
Talaga?
Yeah.
I almost
So
did
it's nice.
that. But decided to take my master's na lang. Ayan, pero classmate Matthew, kapag meron nga kayong call for volunteers, pwede pala ang NSRC. Suot ko ang vest today. Ayan, sila yung mga reservist kasi na nakatapos na ng NSTP. So, sabihan nyo lang kami pag meron kayong call for volunteers.
Duly noted.
Madaming willing tumulong. Ayan.
Indeed. So, this discussion has been very insightful and also quite fun, no? Very conversational, and I hope our classmates and our kasalis were able to get a lot of information from this conversation that we had, mga classmates. Alright, so I think since we're pressed for time, we'd like to thank already our guest speaker, si classmate Matthew from the Veterinary Training Hospital here in Diliman, for joining us and for sharing us his experience and insights on how to take care of our animals, especially our stray animals. So thank you very much, classmate Matthew.
Thank you for having me. It was a pleasure, no? Salamat, at hopefully marami kayong natutunan or at least natuwa po kayo.
Yes, natuwa talaga. Salamat, classmate Matthew.
Maraming salamat uli, classmate Matthew Calibo. Diyan na nagtatapos ang ating programa. At huwag kalimutang i-like ang aming Facebook page, facebook.com/Serbisyong Tatak UP. Mga classmates, tutok po kayo sa susunod na episode ng Serbisyong Tatak UP. Muli, ako po si classmate Gian Librojo ng DZUP.
At ako naman si classmate Ibay ng NSTP Diliman Office. Samahan nyo kami ulit sa October 28, 2024, 11 ng umaga.
Ang DZUP ay kasapi ng KBP, kapisanan ng mga broadcaster ng Pilipinas. Magsama-sama po ulit tayo sa susunod na episode ng Serbisyong Tatak UP dito lang sa DZUP 1602, kasali ka.
Para sa bayan.
Handog ng mga iskolar ng bayan. Inihahandog ng National Service Training Program ng Universidad ng Pilipinas Diliman ang
Serbisyong Tatak UP.
Taas kamay ng mga bagong bayani sa harap ng pagsubok. Huwag kang susuko, bigyan ng boses ang sigaw ng masa. Ang bagong pag-asa ay mula sa'yo, mula sa'yo.